So the first thing I check for the jaw itself is actually I check to see how much opening they have. So they should have about 3 finger widths opening, and so we check that. Also with device, you can check it with 35 to 45 millimeters is relatively normal opening. So if you don't have that device, you can use 3 finger widths of opening. And I always test it with no popping or pain. So I always tell them to open before popping and before you start to get pain. So go ahead and open your jaw, good. And so I can test it, I've got gloves on, so I'm gonna, and she's got like 2 3/4, so it's definitely pretty close to full range of motion, but maybe a little bit limited there. The second thing I look for is to see if, when she opens, if it deviates to the right or left. If she deviates to the right, that means that the disc may be blocking her on the right side, so it stops here, but the left keeps going, so it deviates basically to that right side. The other thing that I like to note is if she has popping, at what point does it actually pop? So if she opens up just at 1 finger width, I note that it happened about that amount of opening. And then if it's 2nd finger width, I note that, and same thing with the 3rd. And basically that means that the further open she gets before you hear the pop means the further forward the disc has shifted and it's popping and running, the condyle is running over the disc. So it's actually better to have popping early versus late. So it lets, and I note what period that popped in. Now the other thing that I always check on is to see if the actual jaw itself is tender and sore. Usually if they have disc issues, usually that's very sore. I would also probably check the temples and ask them if that's sore there. Many times they'll say it is, especially if they've been clenching at night. The other thing that I would check is to check underneath here. A lot of times these muscles are very tight, and when these muscles are tight, they actually cause the jaw to open up, and because our muscles in our jaw are so strong, they'll fight that opening up. And so really you'll have tightness down here because you have the 2 jaw areas kind of battling themselves. And then the masseters always win because they have about 500 pounds per square inch of power. The next thing I would look at is I would actually go ahead and have her open her mouth. I would also look at, I usually go right to this muscle here, which is right where the masseter is, and I just kind of go out like that. And usually most of your patients will find this to be tender. And even people who don't have jaw pain, sometimes this is tender. And again, that's the masseter, and it's probably, you probably have clenching happening at night. Another thing that I would check is I would actually have her open her mouth, so open up your mouth, and then go ahead and close it all the way, keep going, keep going. And then I would actually check and see which side touches my finger first, if it's even. So if it bites evenly, then that's great. But if I get contact on my finger on the right first, it lets me know that there may be some deviation to one side. So the occlusion is not where we want it. So those are the main things that I would check out. And if you can get that patient some help or help them yourself, then they're gonna be a lot happier. Thank you.